And welcome back. We have been joined on set by the new Minister of Health and Wellness, the Honorable Kevin Bernard. Good morning, Minister.
Good morning, Isani. Good morning, Malini. And I'm happy to be here. Different, even though it's a different role now, no?
Yes.
But pleased to be here. Thank you for the invitation.
There's a lot for us to discuss with you in your new role as the political lead for the public health system. We're in the midst of a pandemic, a third wave that is crushing. You come in at a critical time in terms of being able to lead the country forward in the fight against COVID-19, albeit today makes a week, if I'm not mistaken.
Right.
Let's begin by the reception you've gotten from persons within the ministry and, of course, persons within the health sector in terms of being able to come up with a plan that would shepherd us through the pandemic.
Well, first of all, let me say that I'm very much humbled by the Prime Minister appointing me into this very important role. As you know, a very critical ministry for that. But I'm also humbled by the support I've been getting, both from personnel within the ministry, for those who I've spoken with so far, and of course outside from the private sector. There's a lot of medical professionals who have reached out to me, again with great optimism that there is, they believe that there is hope to turn things around at the ministry. I think many people know me for the character I am, and for that purpose, I go in there with focus on the drive to make sure that we build back what may have seemed to have been lost in terms of communication within the ministry. I want to make sure that people understand that I'm here to work with everybody and anybody. And despite whatever differences that may have existed, I want to turn that new page and find the right fix that will be able to lead our health sector, our Ministry of Health and Wellness, in the right direction. We have a lot of things affecting our country, COVID being one of the biggest. But there's also a lot of ailments affecting our people. I mean, diabetes, cancer, and many other things that are affecting us. And so we really have to put together very quickly that team that will drive that vision forward. And so the past few days, I told my wife, I felt as if I had just won the elections. My phone rang off the hook, messages coming in after the other, but it's message of confidence, I believe. And while I'm not a doctor, Marlene and Isani, I believe I bring a lot of qualities in terms of management and team building. That is one of the most important things I believe in making any ministry a success. You build a proper team.
I want to come back to the team and perhaps some of the reasons people are reaching out so quickly. But before that, I understand that you've had a handover of sorts with the former Minister of Health, Minister Shabat. What was that conversation, and what would you say or identify as the reasons as to why perhaps there were the breakdowns taking place internally?
Well, first of all, let me say as well that I myself and Minister Shabat share very, very cordial relations, both outside the cabinet and inside the cabinet. We're great friends. I mean, we all run together in this to bring betterment to our people, and so I want to commend him for many of the great work that he has done as well, despite the challenges that may have existed at the ministry. But definitely, I think that from information I've gathered, I mean, like in everything, Marlene and Isani, there will always be issues, there will always be challenges. Maybe some of the approaches may have been different. I'm not saying that the former minister may be at fault of those things. Well, we never know what may have caused the issues within the ministry. He was the leader of the ministry at the time, and I am now here. And my goal is to make sure that whatever friction may have existed, whether at the technical, senior technical levels, whether at the lower level, at the middle level. My focus is to lead this ministry to ensure that there's unity for purpose. And that purpose is to ensure that we can improve the health services across this country, to ensure that we are focused in attaining our objectives of Plan Belize in terms of our health reform that has to come at some point, but at the same time to move in the direction that we want, where there's equal health for all our
When we look at the point at which you come into the picture, there are critical roles that need to be filled post-haste. We're looking at one, well, you've named a new chief executive officer, but we're looking at the fact that you have the roles that were bifurcated under the DHS to be filled. Where are we with that in terms of you being able to put this team together?
Well, let me tell you this, Marlene. I had to hit the ground running, Isani, from the get-go.
Sprinting, maybe.
Yes. Yes.
Yeah.
I told somebody, it's like, you know, when you're running a horse race, you know, you get in that saddle and get in behind that gate, but the gate was already open. So immediately I had to straight out the gate. But definitely, I can tell you, like as mentioned before, the day I was, it was announced, you know, I got calls from many of my colleagues, friends, personal friends that are doctors, and I've put together a very great advisory team that will advise me in terms of moving in the right direction. We were able to then, and thankfully we have been able to identify a CEO by the name of Dr. Julio Sabiro, who I will personally be meeting sometime today to ensure that we start to chart the way forward for the ministry. But I totally support the fact that when I got in there, I said the first thing needs to be done is to let us address the issue. And when I met with the former minister, that was one of his biggest thing as well, that, you know what, we needed to fill these positions. There exists some bureaucracy in government, as we all know that. But I've said to the FinSec, I've said to the Ministry of Finance, understand it is at you. We need to get this going. The
So the interviews have already happened?
No, there's no interview. The creation of posts that has to be created by the processes that happen.
But they've been advertised for applications.
Advertisement has been done. So all we want to make sure that that final stage is there before we do all the interviews and select the selection of these posts. Now, with all that said, Marlene Isani, I've been talking, seeking advice, looking at the best fit that we feel that can fit these positions. And despite what may have happened with Dr. Manza, I believe that Dr. Manza can continue to play a very significant role in this ministry at a senior level. And I am prepared, and I have also reached out to him over the weekend and today. In fact, I will be meeting with Dr. Marvin Manzanero to see how we can solve this issue amicably.
Your intention is to keep him on your staff?
Yes, I would want to keep Dr. Manzanero at some point in some senior position. I think he plays a very critical role in the ministry. And like I said, despite what people may say, I'm not going in there to look at the political part of things, but to ensure that the professional part of things are done in this ministry. We have a lot of great technical people, doctors, medical officers, professionals that wants to contribute to. So there are key positions: the Director of Hospital Services, the Director of Public Health and Wellness. We also have the Deputy Director of Public Health and Wellness. Well, we do have Deputy Director of Health Services, but because of the abolition of that post, with the new creation of all these posts, we just have to realign those positions. And then there is the Director of International Affairs, which deals with COMISCA. And so it is in those that we are looking at several individuals, candidates that we would want to encourage, or if they have applied. I think we have to look at the best fit, Marlene and Isani.
Let me just come back to the Dr. Manzanero meeting that will take place today. The question is, of course, the public has seen no less than the Prime Minister himself declare that Dr. Manzanero mismanaged the pandemic, and in fact made it clear that they wanted someone else in that post. So if your political leadership and former Minister of Health have said they did not want to work with Dr. Manzanero. Are you going against the grain, saying you want him on your senior team?
Well, I don't think that it's going against what the Prime Minister may have said. I mean, they remember, that has nothing to do with where I would want Dr. Manzanero to fit in at the ministry. Like I said, I think he brings his own qualities, his own. Let me just address the issue in terms of the epi unit, for example. That's one area he was. I believe that we have another great person that we can bring on. We are talking to. In fact, we will bringing over Dr. Russell Manzanero.
The other Manzanero.
Yes, to head that unit. I think that unit needs leadership as well. And there are many other epidemiologists that have been expressing their interest to come in to work with the ministry, to assist the ministry in that unit, because there's a lot of issues affecting this country.
Yeah.
But at the same time, we have to seriously sometimes take a step back and look and say, you know what went wrong? How could it have been addressed? What was the best approach that could have been taken? I want to take that proactive approach and look at things from a different angle, through a different telescope, as you will say, and then let us find a urgent and quick solution to this problem.
Let me ask now about, you said you put together your own personal team of advisors.
Yes.
There's the task force that advises the government.
That's
Is that separate?
Yes, no, two different task force.
So
two different committees.
Okay, so the group that you're working with, they always say in leadership, surround yourself with good people.
Right.
And the key part here is what purpose or what ties do they have to what types of systems? My question is, are you talking to people who work within public health? People who understand that beyond private practice, the majority of people are going to access your clinics, your regional hospitals, and eventually the KHMH, if they need any sort of treatment.
Well, one of the things that I have in terms of the person that I have been meeting with are people who have served for years in the public service, but maybe have been now in private practice, or private medical profession. But these people have years of experience in public health management, in working with the ministry before, and so they know the ins and outs of the health system. They know what are the challenges facing, and sometimes you need to always look at persons outside of the ministry to also give you a different overview of what they feel. And even with that, Marlene, and of course with our COVID medical response team, I am meeting with them later today, this evening, because that team plays a significant role. It comprises of members from the opposition, the chamber, the NGO community, and I think that's a great thing for the ministry. But at the same time, I want to, apart from the advisory committee that I have, to continue build dialogue with others in the private sector, others in the medical profession that knows and seeing what the health system needs. And so I'll be leaning on many of these great minds to guide us.
Have you had an opportunity to meet with the folks over at the KHMH as a national referral hospital? In terms of the pandemic situation, almost all the traffic is directed to the KHMH, so they're also critical in the overall function of the health sector.
Well, I've met with the chairman and vice chairman so far of the board last week, Friday actually, and I am scheduled to organize a meeting with the board first of all, and then go into the KHMH to talk to the people there. We want to ensure that we build great relationship with the board as well. As you know, KHMH should operate more from our autonomous level. There should be no heavy-handedness over there, and I feel that we want to ensure that we build that relationship as well with KHMH. So definitely, like I said, these past few days and this week will be very, very, very busy for me because I do intend to meet with all of these major groups that all fall part of the health umbrella.
Minister, I think over the past year, there's been a gradual erosion in public confidence in the administration of the public health sector from the ministerial level down. Now, you come in at a point in time where, again, we're in the throes of the third wave, And there are a lot of people who are skeptical at this point, either having had tough experiences going through that system once they've been diagnosed with COVID, or seeing how in some cases the response to the pandemic may have been lethargic. How do you now go about building public confidence at a time like this where the disease is raging?
I understand the concerns of and you raised some very valid questions and points there. But I think, as I said, Isani, earlier, if you put the team together, that is what is lacking. Mm-hmm. You need the team to guide you. And without these key persons in place, we will continue to see the same results. Yeah. So for me, it's very important. And that's why I stress on that we need to build an effective team that will lead the country's effort and the ministry's effort in attacking and fighting the war on COVID. But not only COVID, all the other issues that we may be not focusing on, but has to be addressed. The issue of HIV/AIDS, the issue of diabetes, the issue of cancer, all the other ailments. And so we have to take a comprehensive look. I believe we also have to, I would want to reach out to both, and both from the public sector and the private sector, for us to take a great stock of what needs to be done.
But when you say team, are you talking about technical persons employed in public service?
That is right, yes.
Okay.
I'm talking about the people that needs to be
the director of
hospital services, the director of public health. These are the people I'm talking about.
Now, how do you envision your role moving forward? Different ministers in the past handled it differently. Under the past administration, the minister was not visible, nor the CEO. In fact, it was mostly Dr. Manzanero as the face of addressing the pandemic. Then with Minister Shabat, we saw more of him taking an active role. How do you think you will, or what's your plan on how you will be involved?
One of the things that I want to do, of course, as the minister responsible, people will see me as a face, but I think that we have to look at the most important critical thing here. We have to depend on the technical people that leads these units to be the face of these issues at the same time. I mean, I want to give credit to Dr. Melissa Diaz-Musa, who has been extraordinary. I've only heard nothing but great things in terms of her work that she has been doing. And I think that she plays a very critical part of this ministry and the work that I want to move forward as well. So my role will as the minister is to work and support these technical people. And likewise, like I said to somebody, leadership is not just from top bottom, but from bottom up as well. And so when you strike that balance, you are able to be more efficient and more effective. And so answering some of the tough questions, I'm not a medical person. We need the right guidance. And so, I mean, looking at Dr. Melissa, again, I use her as an example, and you can have many others that I can point to.
There are many other hardworking
that will be able to
people in the
be
ministry
at the forefront along with me, together answering these questions, addressing the issues that is facing this nation in terms of health, but at the same time making sure that we are achieving the goals and visions set out by the ministry in addressing the many issues this country needs to address.
Now, I said I'd come back to it. Of course, you said you were inundated with phone calls and persons reaching out. You know, the Ministry of Health has always been under-resourced, but in a pandemic, there's a lot of spending that has to take place.
Yes.
And there's always been issues and challenges regarding how contracts are giving out for pharmaceuticals and now for other things that are needed for fighting the pandemic. Let's talk about transparency and how critical it's, how much, what's your plan in being able to have the public have confidence that the money or the resources that you do get are being allocated properly?
Well, one of the things, Marlene, I will go back to my years as the mayor of Orange Town, and while that may be a smaller level of governance, I think it shows the direction that I will want to take as well at the ministry. I've done it at the Ministry of Youth and Sports and Governance, and it's likewise the same type of management style I'm bringing, where we need to make sure that decisions that are made, contracts are being awarded, it will go through the necessary processes that it needs to take, the tendering process or whatever process that has to it will be open and transparent to the public, and that is the direction I am going to lead. And that's what I'm saying, and I do believe in terms of, I will touch a little bit on the e-governance thing, because I think when we talked about e-governance the last time, I would say, okay, building trust in government services is critical. We need to make sure that we use e-governance to our advantage. Digital transformation of government is also part of making sure that the good governance agenda is being achieved. And I am going to play a very significant role in ensuring as well that we at the Ministry of Health moves our ministry in that direction too. Because people want to see trust restored in public life, in governance. And so I want to champion that. And so I can commit to the Belizean people that as the Minister of Health, I'm going to make sure that our ministry moves in that direction. We have to be accountable to the people. We have to be transparent and open to the people. So these things shouldn't be things happening behind closed doors. There's a process, and once the proper process are followed, there should be no problem.
Minister, the CEO's position is an appointment, and you've identified Dr. Sabido as the person who's going to be the Chief Executive Officer of the Ministry of Health and Wellness. But there are skeptics out there and other people who believe that he doesn't come with the requisite experience in the medical field or the system itself to be able now to be the chief technocrat at the head of the ministry. Walk us through that process in terms of how he was identified as the person who's going to fill that particular post.
Well, one of the things, as you know, as a minister responsible now for health and wellness, it gives us the opportunity to be able to select somebody that we feel will be best able to move in a direction that I would want to go. And while there may be that skepticism, as you say, out there, I mean, the same thing people may say about me, that I'm not a doctor and why I'm the Minister of Health. But it's not about that. While Dr. Sabido, who has a vast majority of experience in the health system, he has been in the ministry for some time, he knows the running around in terms of the ministry. His role now, apart from when he was a technical person, his role now is more administrative. And the function of the CEO is administrative. We must both depend on the technical people that will guide the decisions of the ministry. So you see, there's separation of powers, as they say. You have to know where your role is, and that is the direction I'm going to, I want to ensure that happens. I can't go to the doctor and say, this is what I want you to do. I'm not a doctor. They are the ones that has to guide the policies and the processes and, of every unit that we govern at the Ministry of Health. So the CEO plays a very critical role. Yes, he's the accounting officer. He has to make sure that what is being spent properly, and the oversight comes with the minister as well. So we set the policies as government. They execute the work. The technical people makes the decision that will best trickle down to the improvement of services to our citizens. That is critical.
Sorry, how involved do you plan to be in the selection of the 3 directors?
I believe that
the interviews haven't started
yet.
Yes,
that hasn't.
Or shortlisted.
I believe, Marlene and Isani, that as the minister, I would really want to see the best fit of doctors, technical people that will be able to lead the ministry. But there shouldn't be much interference from me as the minister, because I think there's a process. These things go through advertising and make sure that so for me, I think more the CEO and other technical people that will lead the interview panel or what that will be set up will play a critical role in making sure we find the right person. Now, to say that I will not have an influence or anything over that, I would really want to say that we would want to be able to say, you know what, can we allow John Doe or whoever, Dr. A or Dr. B, to be one of the possible candidates. But it's not me to say that. It's not me to dictate that. It is for the panel to decide. My encouragement will be to go to approach some of these doctors and say, no, I need you to apply. Try and apply. I mean, I would want you to be part of this team, but you need to apply. That's the only thing I believe I can do in that aspect.
And it's also, it's a public service post too, so
that's
I think
right, yes.
it is
so
important.
That goes through the public service regulation.
Yes.
Right.
All right, well, what we're going to do is take a very quick break. What we have to talk about is how you plan to respond to the growing wave of cases that we're seeing in the country. So we got to talk about that and vaccination. That's coming up in a few, so please stay tuned.
Sure.
Whether you're at home, on the road, at work, or at school, if you see news happening or suspect that something might be up, call or text the Channel 5 News Belize tip line at 672-5555. You don't have to give us your name, just give us the tip. That's 672-5555. Call or text us so we can check it out.
Are back, and we're moving into the second part of our conversation with the new Minister of Health and Wellness. And typically we could be very forgiving to say it's only been a week, so we wouldn't ask you what you plan to do.
Yes.
But in 1 week, we are now recording the largest number of active cases in this country in all the pandemic. And I'm sure that today's numbers will only add to that as we keep on hearing of new people being infected. You don't get the grace period of a learning curve here.
That's
you
right.
got to jump in and get
fire,
working. Yes.
Yes.
So what is the plan to deal with the Omicron wave?
Well, one of the things, speaking to quickly as I know, as I said, we got right into this thing. The numbers have been soaring. But what gives me a bit of comfort, Marlene and Isani, is that we're seeing that the hospitalization and the people in the intensive care, ICU, and sadly we had 2 deaths recently, and condolences to those families. Again, unvaccinated person. We're trying to encourage people to continue to get vaccinated. Let us continue to ensure that we fight this pandemic. But indeed, as the numbers are reflecting, and you earlier mentioned, Isani, the third wave, from what we are understanding from the EP unit, we feel this is the 4th wave already. Okay. And the numbers have been soaring, and they feel that within a week, we should start to see some sharp declines in numbers as well. The Omicron, apparently, from what has been shown, doesn't last as long as the Delta and the other variants that we have had over the years. So we are hoping that while there is a rise in numbers, we continue to see less hospitalization. We're hoping that that is the case. We're hoping that there's minimal need for us to have, and we're hoping that there's 0 deaths. But we also need to ensure that the campaign to get people vaccinated is boosted. I know, talking to Dr. Beer, a wonderful lady, I first met her, but so passionate in the work that she has done, and I want to give them my much more appreciation on behalf of the former minister, and of course on behalf of myself, that these are people that have been behind the scenes, working, strategizing, putting every effort, and in speaking to her, for example, in the Toledo district, where the numbers the uptake of vaccines are a bit low, they have been trying all sorts of things, house-to-house campaign that has to take place. Somebody said to me, we need to go like when you're politically campaigning, let's go on the ground and just get the message out and get people and convince people to get vaccinated. the numbers that you are seeing in terms of person vaccinated, when you look at the target age, the target range, the targeted population, we are at a higher rate. But when you're comparing it to the overall population, it's somewhat at 48, 52 in some levels.
Hovering below 50.
Right, you know, so hovering below 50 for fully vaccinated. And now we are also starting to ensure that we start to put more the people that are to be getting their boosters. So we want to encourage people as the residents and persons around the country to go out and get your booster shots. If your time is where you are in the time period where you can get a booster shot, get your booster shot. It's critical.
Well,
so there's a lot of things we have to do, Marlene.
That's one of the questions I want to ask on the booster. In some parts of the world, they're looking at classifying fully vaccinated as a person who's received their booster shot. I think our booster rates, what are we at? About a little bit over 20,000 persons.
Right, yes, a little over 20,000.
Out of almost 200,000 persons
right,
have received their boosters.
That's right.
That's very low.
That's very low, yes.
And we know that the booster helps in being able to fight off the severe forms of the disease.
That's right.
So what's your plan? What's the idea that you have going in on how we can get more people vaccinated and more people boosted?
One of the things, like I said, I think the ground and house-to-house campaign that has to happen. I think it's critical that we get our people out on the ground. There's more education that has to take place, both utilizing the media, utilizing the radio, whatever options, but flyers. But nothing beats that personal house-to-house. I think that may be able to, and then we have to make available sites more accessible. I think that we have to look at where we are in terms of, I know we are very limited with personnel. We have to look at that factor too. Human resources is very, very limited. But as much as we try, I think we need to reach out to the business community, especially large businesses where we can go in and do campaigns. You know, we're going to go into Belize Bank, for example, and we're going to do a booster campaign here at the Belize Bank, get everybody, and do all these major supermarkets, so maybe those are some of the options that we can use to reach out to more persons.
At one point, government considered mandatory vaccination, backtrack from that decision. What's your position on that?
I always believe in respecting the rights of everybody, of people. I do understand, Marlene and Isani, that people want to live and go back to some level of normalcy. But we must also, in some way, be responsible, right? I mean, if you want your freedom, then get vaccinated, man. So while we would not want, I do not support drastic, draconian measures in terms of demanding that people are vaccinated. I think there has to be a fine balance as to, and I use sports as an example. I always, as a former minister responsible for sport, I've always said, and we put together policies that you want to play sports, go and get vaccinated. We will open up sports, but for vaccinated people only. So it's somewhat like a type of mandatory thing, but not to that level that it's being draconian. If Belizeans, I want to encourage our Belizeans listening and those that will tune in at some point. If we are to end this pandemic, if we are to fight COVID-19, we must do it together. Our frontline workers, our doctors, our nurses have given much of their time and energies, some of them sleepless nights, working extra hours. I mean, I take my hat off to them, listening to the many concerns just over these past few days. But we must be, as an individual, I must protect myself. You must protect yourself and your families and your loved ones. And if all of us think in that direction, Marlene and Isani, we can turn things around rather quickly. And so I think that it's very important that we keep stressing that to our citizens, despite those who have doubts. And I think we can we can how would I want to put it, lay their affairs to rest in terms of giving them the statistics, the science. Study the science and you will see that it proves that vaccines save and protect you from being seriously ill.
I think that there are two areas where there's a great challenge. One is in getting people who have already formulated an opinion against vaccination. It's getting them to a point where they would consider. But then it's also the group of persons who are vaccinated or perhaps had one vaccination, understand the disease is there, but don't take the adequate amount of protection.
Right.
In other words, they'll still hang out with friends. They'll go by the seaside and drink and take off mask and those are ways that the disease continues to spread. So it goes back to what is the country's decision on how to ensure that these types of exposures or risk for exposures are minimized. I know you've already publicly stated that the curfew moves beyond to another month.
Right.
What other measures are you considering or discussing as to how we can cut down this particular spread that we're facing right now?
Well, to give credit, I think I mentioned earlier that I will be meeting with the COVID medical response team later today, because I have not had the opportunity to sit with them, because these are the people that guide and make the recommendations to cabinet.
Yes.
And so I would want to give that opportunity for me to sit with them before I say something that is not being recommended by the medical advisory committee.
So they will give recommendations as to ways how we can reduce
the spread, and I will be guided by them. And then we take that to cabinet for further decision.
Well, I mean, because the challenge with COVID is what we've always seen. There's an economic impact, there's a health impact, social impact, and an economic impact. And right now, I know the concern for many employers is the number of people being sick at once.
Yes.
We haven't started talking about what the claims from Social Security will be. And also, the Ministry of Education relies on the Ministry of Health to advise on whether or not to go back to school. So these decisions and these positions are absolutely crucial for everyone.
Right. That will be one of my biggest questions to the doctors later today as it relates to school, the numbers that we're seeing. Because
you have a child who's not within the vaccination rate. Is she going back to school?
She is still doing online classes at this time.
Okay.
And as a parent, and I'm speaking not as the Minister of Health, but as a parent, I too am concerned for her not being, because of her condition. And you know, my wife repeats this to me every single day. So there are many parents like that. That you know would want to see that at some point we get the vaccination in for the 5 to 11-year-old, which I know we are working very hard on. I know that we are waiting on CARICOM. It has something to do with the CARICOM decision. Speaking to Dr. Beer, the numbers have been sent out to them, and so we are hoping that within a month or so we should be able to get some positive feedback in terms of when we are able to get those vaccines for these age range.
With the public health crisis, you are also responsible for guiding the way forward in terms of curfews and what have you. Where are we with that? Because you have persons who are of one opinion that the curfews at this point is rather, well, they're rather ineffective because the transmission of the virus is so rampant that it doesn't really, some would argue, doesn't really make sense. But others would say, you know what, at least it sort of helps to stem the overall or the totality of its spread. Where do we stand on that?
Again, I'll be guided by the medical COVID response team. But if you ask me on a personal note, I think it has two ways. And I do agree with both notions, that the curfew reduces the number of persons that will be hanging out thankfully we still have the bars and some of these places closed down at this point in time, because that will be another issue. But it also allows for a bit of control. On the other hand, you have the bus industry. Let's use the bus industry. People travel every day, and we have some big issues with the people on buses. In fact, I just got I just got a video sent to me yesterday on one of the bus lines where the bus is overcrowded. So enforcement in terms of the bus industry is another issue that has been raised on many occasions that has to be looked at.
Yeah.
So there are many ways that that the spread can continue. There's many ways. So the curfew is just a factor, a part of trying to mitigate and hold down some of the issues. However, let us be real. If we are to go and open back the border, if the border do open as when it is stated to open, if Cabinet makes that final decision and say, okay, we are opening the border, then we will really have to sit and look back at what the curfew will do. Because then if you open your border is not closed, it's open 24/7.
Do you support the border reopening in 2 weeks' time?
I support the border reopening, Marlene and Isani. I think that we cannot continue to live in this closed
sort of an isolation.
Yeah,
right?
isolation. I think that, however, and again, it may sound as if we're trying to be put in some draconian measures, but I think that personally, and from my personal view, if the border is open and you want to take a trip to Chetamal, then you need to be vaccinated. Get vaccinated and you could travel. You know, and there has to be some form of strict regulations for those coming back, whether it is in 24 hours, whether it's after 24 hours. So those are discussions that has to be had. But and I know that these are questions that will be discussed later today from the COVID medical response team. These are things that I have, questions that I want to raise to get guidance from them, because at the end of the day, Cabinet will be also guided by the COVID medical response.
What are your
Well,
thoughts?
Quintana Roo is currently in yellow phase,
Yeah.
so they're seeing an increase, like everywhere else in the world, increase in cases. So is it still the right time, come February, to open the border?
I will be guided by the medical people to decide, to advise me and to advise Cabinet what is the best option. Again, when we were discussing the border reopening, we did not have this huge number of cases. So we have to really look, and then we have to look at what is happening across the borders. And so what measures do they have in place over in their countries so to avoid further spread and so. But again, I believe that we have to always look at the fine balance between whether or not we do it or whether we do it.
Well, you got to also consider what is taking place currently within the commercial free zone.
Yes.
Over the past week, we've reported on a ballooning of cases there. And so while the idea is to be able to continue to spur economic activity, you're looking at a particular location in the country where, aside from the sugar industry, the free zone and all the commercial aspects of it creates employment for a lot of people who are in the north. And when you look at the number of cases coming out of the free zone, it stands to create an issue for people who live in Corozal, for people who live in Orinjoak, or persons who traffic in and around the CFZ. What are your thoughts on what's happening there?
When it was brought to my attention, we quickly look at the numbers. Out of almost 1,000 people that was tested, 174 the initial results, a little over, I think the percentage that they reflected, 10%. I think that while the results that we got at the free zone, this is my personal opinion, a lot of these persons may not necessarily have contracted the virus at the zone. It's the method of traveling. It's the method of how they get to the zone, and the interaction that people has. And so that's one of the biggest issue that I have. So you're
reverting back to transportation.
Right. Yes, I believe that's one of the biggest critical reasons why the numbers may have been looking in that angle. Because if you look at it, and you go to the free zone, I've visited the free zone and to see what's process that they have. They really have somewhat a tight process getting into the zone. And right now, what is also proactive from the CEO and the board of the free zone that they're doing. You have to show a vaccination card. You have to be vaccinated to enter the zone. And remember now, the zone is not a free-for-all. So it's only mainly people going to that are working at the zone that has to access the zone, and then Mexicans coming in. So one of the things that we're doing at the same time, while we're doing the testing, the Ministry of Health also conducted vaccination campaigns, and that's something we want to further do in terms of getting people their booster shots, getting persons who are employed and are not fully vaccinated, let them get their full vaccination. Bear in mind that most of them should have been fully vaccinated anyway. And at the same time, we are looking at utilizing some of these vaccines that are about to expire to try and get them into people before we lose them. So we are trying to do all these campaigns in trying to get more and more people vaccinated. So while I understand it may seem a big jump in number, I think 174 out of 1,000 plus people that were tested is somewhat manageable. I don't want to say that any new case is also of worry, but it's manageable.
With the transmissibility, you expect more.
Right, exactly.
And even if not, they have to quarantine until they can test.
Until they can test.
So that again has people down to a smaller staff.
That is right. Yeah.
Let me come back to something you said. What's the current status of our vaccine stock at the moment? How much vaccines do we have?
Yeah, I don't have the current numbers on me. Hopefully I can get that. But I know we do have sufficient vaccines. In I think the last week I reported there was over 300,000 vaccines of one of the I think it's Pfizer, if I'm mistaken. We do have enough Johnson & Johnson vaccine. We have the AstraZeneca vaccines. So there's quite an amount of vaccines. We are not in the stage where we don't have vaccine. We have vaccines, and so that's why we have to encourage people to go out and get vaccinated. Now we don't want these vaccines to expire, and so we have to make sure, and that's why we have to look at neighboring countries. Normally, that's what countries do. That if you're seeing that we are reaching to that stage, I know we have some.
Well, in Nigeria, they've destroyed millions of vaccines
we don't want
because they had to expire, and they did
I understand in Jamaica, it was reported to us that in Jamaica they destroyed over 200,000 vaccines just recently. We don't need that. We can't afford that. So, and that's why we're encouraging more people get vaccinated. So
Minister,
it's very critical for us.
You've had over a year of being in government now, and as you said, in central government. You've been a leader at a municipality. You've seen this, perhaps still getting the grounds of all that is ongoing specifically for health. But from the outside looking in, what's one thing that you hope to improve upon within the Ministry of Health? Not results, but methodologies.
I think that all has to do as well, apart from, I look at it from the overall angle, because I think a lot of the focus is on COVID. But I think the approach that has been done, many great approaches. I think we have to also look back and see where we have to make adjustments. But I want to look at it not only from that angle, Marlene and Nissan. I think that the methodology that has been used has to be readjusted. We have to start to continue the fight against HIV and AIDS. We have to continue to look at how we can address the issue of diabetes that is killing our people. People are dying daily of diabetes. We're not saying these things, but it's there. There are a lot of people who are on dialysis, and so we have to really look at how we're going to improve the health system. And I say this because we need to start to focus on health reform, serious health reform. And speaking to some of the doctors over the weekend, the idea has already been starting to come out as well, that in our plan Belize, it speaks of a clear health reform that has to take place. And I'm one of them that will tell you I support that. Why I say this? KHMH, I use KHMH example. They have a board. It should be an autonomous board. It should be able to manage effectively. Similarly, the ministry. The ministry at some point, it's not about the minister and the CEO. It's about the technical people that will guide the ministry. And so the reform that takes place, the reform that will come, should be able to see us move away from just providing primary care. Because not even at the primary care, we are at a satisfactory level. We need to go beyond that. We need to start to see that our citizens have access to secondary and tertiary care that is more affordable. And I think that is where I said we have to really seek the people in the public health sector and the private sector to do an analysis of where our health system is today. And let us come together and find solutions that will address that. And so it is from that angle I want to respond to that question. That I think that can come when we seriously put our best foot forward and address the reform measures that has to take place in the health system.
So you're seeing more of a macro perspective.
Definitely.
Let me just get you on two more issues very quickly. One, you know, the conversation is only starting to pick up now, but people who have survived COVID are now showing symptoms of long COVID, very debilitating, very diverse. There have been people who are committing suicide as a result of not wanting to deal with the long-term effects. This is in other parts of the world. What's the plan in place to start to look at how you're going to treat these persons? And then also, shortage of healthcare personnel, specifically nurses. It's been difficult to be able to keep nurses in Belize. I know the government has implemented a scholarship program, but even up to today, there's still a shortage.
You hit the nail on the head as it relates to the whole issue of nurses and people in the health system. And yes, there's the issue that we have been losing a lot of nurses to other countries that they offer them better paying jobs and all that. So we have to, again, when I talk about the reform, it boils down again to that. We have to take a proper look at the public health sector as well, in terms of how are we going to ensure that our nurses can stay on board. We have to seriously look at when we are sending people. I will use, you see, we have the Cuba Brigade. We have sometimes 12 people going to get a scholarship. But we have to start to focus as well that when people are going out to get these educational opportunities, that they come back specialized. You realize that in Belize, there's not much people that come with specialties. They come back, general medicine and so forth, and then that is flooding the system. But you need more specialties. You have to. There's need for specialization in the medical field, and then so you have to get people who go and become
but the argument is that they can't really, they don't make as much in Belize as they would make in other places. Those who do specialize leave the country. And
I totally understand that, but I think that we have to find a mechanism in place that we are able to. I will tell you my personal opinion. If I am sending Marlene or the government to go and train to become a pediatrician or a gynecologist or a neurologist, then I expect that when you come in, you can serve this country for an amount of time. There's some bond that you have to put.
But there is a bond. And I don't know how much people are held to it.
And that is where I think has been lacking. There are times we go out and you come back, but they don't serve the amount of years that they need to serve. And then it continues to put a strain. But the issue of nurses is something that is very serious. I know that, and we're hoping that those young persons that were given the opportunity to get a scholarship at nursing, and I think about 75, if I'm not mistaken, could continue to contribute. So, talking about strengthening the nursing school, coming up with a medical school that is necessary for Belize, These are long-term ideas that
Yeah.
people are talking about already. So I think from the macro perspective of things, those are part of the issues that has to be seriously looked at. We cannot continue to lose many of our nurses. We have to start to see more Belizeans taking on some of these serious posts as well. But they have to be specialized. I think that we have to look at that. So it's a tough decision, a tough task ahead. But I think with the reforms that has to come, there can be many of these things addressed over a few
Minister,
years.
my final question, forgive me, is from a political perspective. How do you respond to your detractors who last week during a press conference came out with several concerns, including the fact that while you are not a medical person, not in training or otherwise, that there are questions about your ability to lead the overall ministry at this particular point in time, and the fact that you are coming in at the absolute worst time in terms of the overall crisis that the country is facing in public health. How do you respond to those criticisms from the opposition?
Should I answer the leader of the opposition? The leader of opposition, I heard his comments. But I think they need to reflect and take a look at the mirror. I said to somebody, and that's what they did for the past 13 years. The Ministry of Health is not in this situation just over a year. It was run down, it was politicized, it was abused, and so despite the fact, regardless of what their comments are, I can say to them that my focus is on making sure that I lead this ministry with accountability, with focus, with enthusiasm, with optimism, and with the energy that it requires, but by building an effective team. And I keep saying this because I am committed to that. It's not Kevin Bernard, it is about all of us that will be able to achieve the objectives of improving and giving and making sure there's equal health for all citizens of this country. I have proven myself, I believe, over the years. And let me just throw a thing to the minister, to the leader of the opposition, sorry. He served as the Minister of Youth for years. And I met a demoralized, a broken system in the Ministry of Youth and Sports. We turned that around in 1 year. You could ask anybody in the Ministry of Youth today, and they will tell you the level of work that we were able to put in just 13 months. We have a proactive ministry. I want to do the same in this ministry. Like I said, there are great minds at the Ministry of Health. There are great technical people, and those are the people that will help me to make things better for all Belizeans when it comes to our health system.
Well, we appreciate you coming in and having this first conversation. I do hope you've said very clearly you want to be as accessible as possible to the public and media and to the media. So we hope that you come back and that even when things get tough, as no doubt they will,
that's right,
you'll be here.
Definitely.
All right,
thank you. Thank you for having me.
All right, we're going to go ahead and take a break. When we come back, time management skills to help you in both your personal and professional life. That's coming up in a few.